Welcome to the third episode of CES Tech Talk. Today, we're diving into the exciting world of digital health, where I'll be talking with Robin Raskin and Jill Gilbert of Living in Digital Times. Enjoy! I'm so excited to have with me today my, I'd say longtime friend, that makes it sound so old, but we've known each other for a number of years. My good friend, Robin Raskin. For those of you who don't know Robin, she is the founder of Living in Digital Times, and that's a team of technophiles who bring together top experts and the latest innovations to look at the intersection of lifestyle and technology. We've worked with Living in Digital Times for a number of years to produce a number of key conferences and events at CES. Last Gadget Standing, one of my favorites, a Digital Health Summit, Fashion Wear, Fitness Tech, Kids at Play, just so many different markets, so many different things that they've produced. Robin is an author, she's an entrepreneur, she's an editor, she's a magazine publisher, she's been a blogger, TV, radio personality, a good friend. I first met her when she was with PC Mag, which again dates us.
And now with digital health, I could be a brain surgeon tomorrow.
Exactly. And also with me today, laughing in the background, is also my good friend Jill Gilbert. And Jill is a self-described catalyzer of people, events, and ideas. I love that. Her experiences, she's been a speaker, a publisher, she's a Silicon Valley entrepreneur, she's even been a Hollywood producer, and now a industry conference curator. She also helps produce the Digital Health Summit at CES, Lifelong Tech and Robotics on the Runway. And she founded and premiered the Digital Health Summer Summit in 2012, which continues to grow. Previously, she served as vice president of e-commerce at caring.com. And she spent several years in feature film development and production at Columbia, Disney, MGM, and Lovespell Entertainment. And I'm just me, Jeff Joseph, Senior Vice President of Communications here at CTA. So with that lengthy introduction, welcome. Thank you guys for being with me today.
Great to be here.
Thank you.
Hey, thank you guys. As I noted up front, digital health really covers a lot of topics, from telemedicine to wearables, from digitizing medical records to diagnosing rare diseases. How do you guys define digital health when you're planning out the session in the series at CS? How do you define it? What do you consider digital health?
Well, it changes, and we watch it every year. And you both remember, Jill and Jeff, when we started this, we said, what doctor is going to come to Las Vegas to look at stuff?
Right.
And so we started very simply because really the regulatory and policy dictated that you start owning your health care. And so it was fitness monitors and it was heart trackers. But now Jill's taken us into areas of genomics and of personal drug cocktails. What is Big Pharma doing? I mean, it's all new surgeries, new releases of medicine internally by bots inside your body. So it's changed so much. And the one thing that has become clear is in order to make it in this very complicated world of digital health, you need people from all of the various walks, policy and product, all working together. And I think that's Jill's ultimate goal at Digital Health Summit.
Jill, did Robin describe that well? Anything you want to add?
Yeah. I mean, I really look at digital health as this gargantuan umbrella. It is really just kind of the holder of everything that falls under health and wellness. And so that could be everything from anything tele, we used to use the word mHealth, which we don't really use that much anymore, but anything mobile, anything that just keeps you well, potentially like a fitness tracker. So on to anything that's happening in like surgical robotics. So it's quite a large umbrella.
Well, it sounds like it's sort of large scale. So things like surgical robotics down to really that personalized data, personalized control. Yes. I'm fascinated by this concept of a personalized drug cocktail. That sounds something straight out of Fear and Loathing in Las Vegas.
And now they have ones that can shut off and on. So people get too much of a drug, especially in cancer care. I mean, what's going on? It's going so quickly, much faster than regulation can keep up with it, and going into areas like mental health, using virtual reality as a treatment for mental health. I don't even think we would have thought about it 2 years ago, and we're seeing so many new applications to take care of both mental and physical health this year.
We're going to talk a little bit about some of those technologies, the broader technologies, and how they're impacting digital health. But you mentioned regulation, and can you give us a general sense of the state? As you know, I used to work in biotech. I know how difficult it can be to get products and therapies through the FDA. What's the regulatory state for broadly defined digital health today? Are products actually entering the marketplace? Is the regulatory process in a place where we can speed these exciting innovations to consumers and to patients? I think that was for you, Jill.
Oh, okay. I'm sorry.
That's okay.
I don't get the IQ.
Robin was giving you the eyes, but you couldn't see.
I didn't get them. So, yeah, I think, first of all, I have seen recently definitely more things coming through the FDA. I see more and more. I believe what they are becoming is they are becoming a partner to digital health innovators, which is so, for lack of a better word, lovely to see. So there is a long cycle and a proof of concept cycle that it's a rigorous process, but they are sending things through that they are seeing relevant. So I do see that starting to happen. And I was privileged actually to go to the CTA event that they did with the FDA and really learned what they felt their role was. And I really think that anything that requires sort of serious tracking and serious, that we need the numbers, it's being used in a clinical trial, or it's being used in the hospital, or it's being used by physicians, things that we need severe accuracy for, that they are heavily involved and still learning their way, still learning their way on maybe the consumer side of things.
And I think what you saw at CES in the past couple of years, fitness is kind of where it all started, because you didn't have to be FDA regulated to be a fitness device. So you take a concussion tracker. It was Reebok did it, and it was a great tracker, but it never said, "Oh, you've had a concussion." It let the coach know the torque and velocity that you were hit at. Now, it's a regulated. It's becoming quickly a regulated device stemming out of sports and monitoring. So as we get more precise about monitoring heartbeat, steps, force of being hit, these things will start to gain FDA approval and awareness. And I think that's happened and will continue to happen big time this year.
So how do we strike that balance between allowing that innovation to continue and not letting the necessary regulation and safety protocols get in the way? It's a careful balance.
Well, I do have one thought about that. I think we're starting to see, we are starting to see much more sophisticated sensors. And if you take a company like Valencell, they have done talks on clinical grade wearables. And those clinical grade wearables are going to become are going to move their way into sort of the over-the-counter consumer wearables, the fitness devices. So I think what's going to happen is these sensors are going to become much more sophisticated, much less expensive, and work their ways into consumer devices. So I think then the FDA will be getting more involved in that side of the business.
Are we seeing some of that standardization occur? I know CTA has been at work in the area of sleep, for example, to make sure that there's some consistent standards on how we measure sleep and what that looks like. As we move through the maturation of this segment, are we starting to see some of that standardization occur? And I guess that in the long run, if it is occurring, that does help the FDA monitor and regulate the performance.
Yeah. Where it's going to get tricky, the standardization is working out pretty well. The actions you should take is still a little far behind. So you don't know my body and my heart rate and what's normal for me, and yet I'm put in a norm that, should my device be reporting it to my doctor if my heart rate is just a low heart rate.
Right.
So I think more and more, right now the data is getting more and more accurate. The actionable part, as I think Ginny Romberg at IBM likes to say, everybody is going to have access to all this data. It's how you act on it that's going to make the difference, and we're not quite there yet. And people will not adopt these things if it's not actionable. So let them go, and they'll sit in their drawer.
Right. Well, that's a great segue to my next question.
Oh.
One, are we seeing consumers? We've seen the sort of the plateau in the sale of fitness bands, for example. Are we seeing consumers embrace these devices, or is it too early?
I think there's a right size eventually. You know, every product, take PCs, you know, whatever it is, they all come out to market. There's a million lookalikes and copycats, and then somebody nails the ecosystem that you need to survive, and the market shrinks accordingly. So I would say you probably have, you know, a core devotee of fitness. They never take their fitness bands off. You have some people that use them and internalize the message, like, I got it. I walked my 10,000 steps. Corporate stuff is going fabulously. If you have a corporate wellness plan and you can save some insurance money because you've walked your steps, and they're seeing the differences. I would like to posit that I have seen the CES weight, on average, go down since fitness bands existed.
That's your personal. That's what you've seen. It's may not be factual, but it's what you've experienced.
You meet them in the hall. They go, "Oh my God, I walked 20,000 steps today."
Because you can now quantify it, right?
Exactly.
And I think you're absolutely right that there is. It does. You know, I check mine constantly, and it does incentivize me to make sure I'm up and moving. But as we get into deeper into, as these sensors become better and better and more accurate and able to collect more data, does that make consumers, are they concerned about that? Does that make them more comfortable? Does it make them more are they going to embrace this? We'll get into privacy in a second, but do we want to know that much?
Jill, you've done that with pregnancy. You've done it with sleep. Like too much.
Yeah. Well, it probably is. It's probably overwhelming for most people. I'm a sharer of information, but also in every other area of my life. So I'm probably not the best example because I don't feel like I have a lot to hide. But and if I can contribute to the greater being, so there is that group of people. But I really feel that people feel protective of their information, especially after, not to compare, but to the Equifax data breach. They feel protective of their information. And so I think under certain circumstances where you're sharing with trusted individuals like physicians, I don't think people are upset by it. I think people, would like nothing more to have their information shared. At the same time, look at the aging space. A lot of seniors don't want to be tracked at home. They don't want that information. So I think this is a sensitive area. Either it's going to go really mainstream, or it's going to be cut back a little bit. And I think we have a lot to learn in that. I still think we're learning. I don't know, Robin, if you have the same opinion, but
no, I definitely agree. And I think there will be new technologies actually from outside of the medical area, like the blockchain, that will help us.
Yes.
I don't want everybody seeing every piece of my information, but I certainly want to release my information. And then I think doctors who are afraid of getting barraged by all this personal information about their patients will learn how to set up ticklers so they're notified if there's a delta of change. For example, if I'm watching an aging person who's at home, I'm monitoring their blood pressure. I don't need to monitor it constantly. I need to know when something's wrong. And I think we're missing those systems that sort of go around these devices that are by and large starting to work really well.
Sort of setting up those baselines of
and they are happening. They are happening. I actually have an interesting example. We have, this isn't really notification, but this is trying to put products into the consumer's hand. Travelers Insurance, in conjunction with a couple other partners, put together a sort of, I don't know if you guys have heard of Fab, whatever it's called. It's like a box that you get all these gifts in.
Oh, right, a monthly.
A monthly
okay.
sort of something. So they put together this gift box, the FatFitFun of health, of digital health, that people who, let's say, I don't know the exact example, but I think it was that they went through are on workers' comp, got a workers' comp claim. So here they are primed for opioid addiction, right? Painkillers and other types of relaxation and healing devices. They actually put together these boxes, these gift boxes that included, VR, a sort of neurometrics quell device kind of pain management. And so I think it was really interesting to see these like gift boxes of connected technology going out to these people. So and that information is going to be shared with travelers.
Right. And there's benefit to that. Obviously, Robin, you referred earlier to the ecosystem. So you've got the patient involved, you have your physician, you have your insurer, payers, you may have family members engaged.
Now. I just went to David Barton's gym in New York, and they give you a full workout assessing, with your body fat composition and then derive your workout. And so and they're unknown pieces of the ecosystem.
So great. So again, how are we dealing with the privacy surrounding these issues? Or maybe the question is, who's responsible? Does this fall under HIPAA? Does it fall under is it the responsibility of the manufacturer of the device? All of the above?
Yeah. If the manufacturer of the device has it where you are sharing data and you are utilizing their platform and or integrating with another's platform, it is definitely the requirement of that platform, so to speak, to maintain your privacy. Hence the major discussions around blockchain, share data.
But it's so ubiquitous now. I mean, tell me you're not afraid to search for a medical condition on Google. You are. And I saw a startup yesterday who had through their workers' compensation plan a mental health component where you could talk to an AR, like a roboticized shrink. And I said, oh my God, I would never do this this is where I'd stop doing things through my employee, my employer, because it gets, so I think ultimately, and you've seen it, as Jill said, with Equifax, you've seen it with Google search, I think ultimately you are going to be the owner of these things and dispense the pieces of your private life out when it benefits you and not when it can hurt you. And we're going to have a lot of trial, error, and pain.
And to get there. It's ultimately, it should be the consumer have the power, the patients have the power to determine what, how, and with whom it's shared. And you guys believe that those systems are coming into place to allow for that control. You're optimistic.
Yes, I think the complication is almost like the settings channel on my Facebook, to what gets shared, what gets not, to who, that you can select who might, who not. I think that's the complication that's going to happen in this. It's sort of whatever the settings are going to be complicated, especially if you're using multiple ways. So to me, that's going to be what I see as a challenge for myself, and I imagine others.
Robin, she's smiling away, saying, "Yes, well said, Jill."
Yeah, I think we've all learned through Facebook, and I mean, we've had this experience before. Health is even more mission critical of an activity.
But also so much.
Your bank records. I mean, these are the same issues. What I love about tech, same issues across everything. And you just this one happens to be the difference between life and death.
Right. Well, and I guess that's the difference. It's like choosing among your children. Do I care more about my financial information, my social security number? Do I care more about if I'm searching for a mental health professional? But those same issues about who's responsible and how much control do you consumers, and then that of course bleeds into, while privacy and security are different things, it bleeds into security issues as well. And are we seeing manufacturers and others in this ecosystem baking in those security procedures as well? Are we seeing a growth in technology on that side that's parallel to the growth in the actual technologies?
I believe so.
Yeah.
Yes. I mean, this is. I mean, we're doing a big talk on blockchain this year. The security issues and the privacy issues are immense. There's whole firms that have departments now that are advising companies on how to manage this. So this is real. It could put a big company under if they don't do it right. So yes, I think it's being taken very, very seriously. It's not what you consider the sexy part of digital health,
but it's the critical part.
It's the critical part. I look at it as life and death of these companies. So yes.
Well, that's yet another great transition. Are we seeing money flow here? What's the state of the money follows where they think there's opportunity and success? Are we seeing financing flow into the market? Is the money backing up the promise of digital health?
Yes and no. You know, we have a very short-sighted world of investment sometimes, and digital health requires a long-term vision.
Right.
And so I think that hurts digital health investment. On the other hand, it's still quite healthy, but I think it's the reason you had quick investments in sports things and in digital thermometers, but investments in ecosystems and in working with hospitals and in payers and providers is much more capital intensive and strict. And I think I wish it would be a little more investment there.
The numbers are pretty high, though. I mean, they at least Rock Health was reporting that this is the largest year for digital health. What are we? What month are we in? We're in. This is going to be in December. We're at over 4.7 billion invested so far. So.
Yeah, but I think it depends what sector, and the longer term, more committing sectors, other than genetics. I'd say genetics,
genetics is the biggest. Genetics is the biggest.
In terms of investment dollars going into.
There is,
research.
But I just know Cortigen just went out of business because the insurance companies weren't reimbursing enough genetic testing to let them make it. So it's a really complicated web there. But if you could drive down, the cost of genetic tests, which we will, and in England now, genetic testing, you do it at birth and your DNA is stored. I mean, that's where we should be getting to. And we're going to need some people with longer term visions than building a company and selling it tomorrow.
Right. And looking for that short-term game. Now, I know we are when we've been involved with some major companies who are investing in digital health. So we're seeing some of the big traditional health and medical pharma companies become engaged. Are they beginning? Is there still room for the little guy? And I guess what does it say about the market to have major companies, major brands beginning to invest in this area?
Yeah, I first of all, there are room for the little guys if the little guys do it right. So the little guys can't be, like me saying, oh, we need a new digital thermometer and I'm going to invent that in my, garage, right? And I'm not going to do it without any input because I think I know what's right. I think I know what I need, right? So what you're seeing is groups like, J&J, you're seeing hospitals like Cedars-Sinai and UCSF, you're seeing, Stanford, that are really developing in conjunction with the little guys, right? What is needed from the front lines of healthcare. So we're actually seeing, a problem statement, a statement that, this department needs this, and here's the little guy over here that can help us do that. And so they're actually developing directly with the people in needs. So I think that pairing or matchmaking is the critical part. And after that's developed, then it has potentially commercial value beyond just that department.
No, you're right. United Health, I mean, the insurance companies are doing it. It's like almost everybody has their own incubator looking for solutions. And then at the same time, there are startups. I saw one yesterday, bed sores. I would have never thought. A way to detect bed sores in the hospital before they occur. So just through LED under the skin sensors. And so here's this thing you can actually die from. You get infections that it wouldn't have been but they will wind up selling into one of the ecosystem. So I think it's coming from both ends. People looking and solving. Look out 10 years. Look at physical therapy. I saw one that's done with virtual reality now. You actually move your neck around while you're playing this shoot-up virtual reality game, and that's your physical therapist deciding how far to turn your neck. So I think there are just some brilliant ways to take the underpinnings of the new technologies, AI, AR, VR, sensors, and mold them into new solutions for problems that we've always had.
I want to get to those technologies, but I also want to get to, we've talked broadly about a lot of exciting areas, and maybe just a quick lightning round, and you guys can highlight some of the exciting things we're seeing going on in some key areas. Ready? Lightning? So let's start with the king, the brain. How's digital health helping us understand how the brain operates and brain injuries, et cetera?
There is so much going on in this area. It's why it's such a key role. So let's look at Alzheimer's. We are seeing new diagnostics in even home diagnostics, things you can do yourself at home to detect, and FDA approved, no less, to detect early onset Alzheimer's, new detection roles in autism. And I'm working with a company that's doing a wearable artificial intelligence system that are helping kids with autism. They'll be on stage talking about it. I can't share much more than that, but incredible stuff. We're also looking at the PTSD world. So how virtual reality is helping them. It's being used for pain management and mental health. We have telemedicine, psychotherapy being done remotely. So helping people not only in remote areas, but for people that are, in such deep depression that aren't able to leave their homes. So I think the brain, I'm really excited. We're actually having Adam Gazzelli come talk about this entire world, how they're using gaming and storytelling. I'm really excited about this.
At CS, and Adam is
famous neuroscientist. And Jill, I did watch this at Jill's summer summit. Virtual reality. The guy stuck his hand in freezing cold water without any virtual reality and then had to do the pain where he was on the pain scale, then put on the VR, was transported to another world, and his pain, a self-reported pain, dropped enormously.
Really? Wow.
So think about it. I keep saying the next baby I have, I'm going in with the virtual reality pain management.
I'm on a different scale, but can I apply that to my teenage rearing? Can I be in VR for that pain? All right, that's good. So brain. So we're going to go to another area, sleep.
Sleep is the attention on sleep is pretty shocking. People are realizing how important that it is to managing chronic disease, diabetes, depression, everything. And so what we're seeing, so we've seen the last couple of years that there's been a lot of great tracking. Well, the tracking devices that we'll see this year at CES will truly be pretty profoundly different. It's really taking passive to a new world, right? So rather than having us engage with devices and things that go under our bed, that everything's kind of built in and passively monitored. But where it will be going is how to help you. So we'll start seeing, going back to what Robin said, sort of the action. What's the action you need to take when you get a score of 4 or whatever?
Right. So shut off Stephen Colbert and go to sleep.
Yes, exactly. And then last but not least in sleep, and I'm so excited by this, we have a company coming to announce new sleep induction. I can't share much more, I promise. But we all talk about monitoring sleep, but what about getting to sleep without drugs? So I call it sort of the ambient-free technology. So I'm
I call
really
it taking an
excited
adult education class in chemistry, right? Which my favorite thing is I do the Khan Academy when I can't sleep.
Then you're out. Then you're totally out. There you go. And then one other quick one. How about chronic conditions?
Chronic conditions. Where do I begin? Chronic conditions, if we take things like, diabetes or heart disease, we're working, I've been doing my briefing calls with companies. We have companies like AliveCor and Omron. Omron, obviously a Goliath in medical devices, healthcare devices, and and AliveCor partnering the first mobile EKG FDA approved device, and they are working together to, as they say, go for zero. And the concept, which is a noble cause, and it's it's their mantra, go for 0 heart attacks and 0 strokes. Wow. And how do they do that? And they feel that technology can really aid in that. Obviously, the consumer needs to have and the patient needs to have an active role, but part of the active role is through devices and monitoring. So,
and techniques you wouldn't have thought of, gamification. Uber and Lyft taking, patients to and from senior centers. Because what we know about these chronic conditions is they tend to come in clumps. You don't just have one, but you tend to have, a constellation of them, and they're killers. So if you can gamify lowering your blood pressure and actually do it, with electrodes attached, and if this can all become self-rewarding and actually change behaviors, we're going to see real progress. And I think people have learned that there's no magic pill that anybody's going to take. So much of what ails us, and by the way, Jill, this is amazing, but we are the only mammals that deprive ourselves of sleep. I read this the other day, for no reason at all.
Other than increased productivity or fun or whatever it may be, right?
And bragging rights.
And bragging rights, exactly. We brag about how little sleep we get. It goes back to how we opened the segment, that it's just so broad. So we've talked a lot about sort of monitoring devices, monitoring technologies, but here we have digital health in the area of prevention as well, and encouraging positive behavior and preventive behavior. It's phenomenal. You also talked about sort of the use of VR. You gave an example. We'll see a lot of those big themes that we're looking at for CS, virtual reality, artificial intelligence, even 3D printing. They're playing a role in digital health as well, correct?
Oh yeah, when you look at artificial limbs and exoskeletons, and it's the fact that limbs today can be so tailored through quick trial and error 3D printing. It's an amazingly upbeat story to tell about the power of 3D printing.
Yeah, 3D printing. I actually went to a whole conference around this, and I mean, listen, we're still far off from printing our livers, and printing organs. However, there's been massive developments every year going in that direction. So it will happen. It's just, as you can only imagine.
Yeah, and we're thinking about plastics now, right? But eventually we're thinking about 3D printing anything.
Human organs.
Right, and, from leather to organs, yeah. And so
leather to organs.
It's so I think this is a year you're going to see us quickly getting beyond just thinking about 3D printing as a plastics additive, but other
or chocolate
substrates. Yeah.
I mean,
love that.
Yeah. Speaking of outrageous, who would have thought that an application on our phone could be as effective, if not more effective, than a smoking cessation patch on your or a pill that you're taking? Who would have thought that? That is, we're there. It's proven. It's there. That therapeutic exists. It's, to me, shocking.
It's I'll give an unabashed pitch now for CS. We talk about these tech. You can go to other shows, other events. You can see digital health. You can see 3D printing. But one of the great benefits of coming to CS is you can really see those intersections, right? And that's one of the great things about the Digital Health Summit and Living Digital Times. You can see how all these come together. As we sort of wind down here, as you think about your Digital Health Summit coming up at CS 2018 in a few months in January, Las Vegas, what do you hope people will walk away with as they participate in the exhibits in the conference? And secondary, what are you guys excited about? When we talk next year, what are you going to be talking about that really excited you?
Should I start,
ahead, Jill.
Robin?
Yep.
Okay.
You ding. You're ding.
Yeah, ding. I'm excited by the collaboration that's going on. I'm excited by the collaboration because unlike other fields, I don't know. Unlike other fields, I feel like you cannot survive if you aren't open and partnering with the right people. So I continue to hope, that's my own personal goal, is kind of putting people together and hoping people walk off with new relationships and new partnerships. So that's just like a personal goal, walk away. But as far as, topics and things like that, I am mostly excited about the developments in genetics, in the ease of diagnostics that are going to be going on in doctors' offices, things that you used to send. I'm an impatient person, to be honest, and so the idea that I might get a result in the doctor's office of the blood test that I wanted, that it'll come within minutes,
without pricking you. Right?
I love that.
Yeah, I am am in awe of how people are using digital health to integrate, I mean, people with asthma, they will know what is going on their block.
Yeah.
And on their block, what pollens are there. So it's kind of awe-inspiring. At the same time, we want to make sure that we present the challenges and help people through the process.
Yeah, and I just had, to me, CES, I always say it's like the China Silk Road. We march around in our own little bubbles all year long, doing our own thing, and you get to a show like CES and you see the potential when all these technologies come together. So, for example, why can't your fridge give you a healthy message every day or stop you from eating?
Don't eat that ice cream.
Right.
Don't have that second pint.
Right. How can we involve the arts? And it seems every year we involve more and more disciplines in the solutions that we see at CES. I think, I mean, Alexa, can you give me a tip for staying fit, thin today? So I think we're going to see it pervasively across all devices pitching in to make you healthier.
The connectivity certainly is there, and whether that's connectivity to, we'll have a new area on smart cities this year at CES, at CES 2018, and using those sensors not only to monitor the air quality and then be able to feed you specific information, to your point, if you're an asthmatic, or having the ability to ask my connected device, what's my blood pressure today, whatever those personalized questions may be, right, and see that ultimate connectivity. It's really very exciting. Well, thank you both, Robin and Jill. It's been a fascinating discussion, the one that will continue in a few weeks, days away from CES 2018. For more information for CES overall, you can go to CES Tech. And for more information on Living in Digital Times, we'll send them to
livingindigitaltimes.com.
Well, that's
click
makes
on
sense.
Digital Health.
There you go. It's very straightforward. So thanks again to my guests today, Robin Raskin and Jill Gilbert, and thank you for joining us on CES Tech Talk, and we hope to hear from you soon. Thank you for listening to CES Tech Talk. Don't forget to subscribe to this podcast so you don't miss an episode. You can get more information on the CES show in January at ces.tech. Our show is produced by Tina Anthony. John Lindsay is our sound engineer, and me, I'm Jeff Joseph.